cardiac, QGS, QPS. So here is the QGS, QPS application, and we need data, rest gate, rest tomo, stress gate, stress tomo, and these are the CT scans for the rest and stress data. So just single click on the QGS, QPS, then come to the customization option and click always option here, and then left start, click on this arrow and click left start. So here you can select the study type like 1 day, 2 day Thallium. So this study you can see the stress and then rest, and here rest is done first at 9:45 and stress is done second. So that means it is rest first, that is 1 day protocol. Okay, so click OK. The software is automatically calculating the and detecting the left ventricle. Now see, it has automatically detected left ventricle, and you can just verify whether the software has done accurately. So this is 1 to 13, this is again 1 to 13, this is 1 to 13, 1 to 13, and you have to see whether this slice is matching exactly with this slice, and this slice should match with this slice, right? If it's not matching, you can like rotate like this and reorient it. So, or you want to go with the automated one, then second option is go to the recon and reformat mask. So if you want to mask the extra cardiac activity, then you can select this and position around the LV. So this is optional, not mandatory. Okay. All right, then apply.
So it will separate all background activities.
Yes, yes. Then click back and go to the inspect options. Here you can see the slice which is reconstructed with the filter back projection, and these are the pre-filtering available, none and Butterworth match winner and any. For cardiac we are using Butterworth, and these are the critical frequencies, cutoff and power, so that you can adjust to get the best picture.
Yeah, the options are there on new ECTV or
So this was already there, these options. The additional thing is like you can use iterative recon where you can see a better quality image, and here you can select Restomo, and again you can make it to iterative recon. Here is the number of iterations and subsets you can change if required. Okay, and after this you can click proceed. Now next step is attenuation corrections. So click on the stress image and go to the attenuation tab, click proceed. the attenuation correction screen, and here you can see it's not perfectly registered, so it needs to be corrected. This also showing that the ROI is going to till the ribs, and for correction you have to click the adjust registration. So these are the coronal, sagittal and axial views. If you want to select the organ orientation, these are the short axis, vertical long axis and horizontal long axis images. Now click on the middle image, and these are the tools to shift the images. So shift little bit upward and slightly this way, and now you can scroll and review again. Now this is better, and then click proceed. Similarly for the second data set, this again need to be adjusted. Okay, click proceed. Next is to click on the this review tab. Select the gender. So these are the different options here. This phrased view, and manually if you want to center it or mask it, you can do that. So these are optional, not mandatory to mask the activity. These are both the studies. Then these are the projection images. If you want to calculate like heart to lung count ratio, so this will give the ratio here, lung to heart ratio, that is 0.33%, and TID is calculated 1.03. TID is a transient ischemic dilatation. That is nothing but the ratio of the volume of the left ventricle between the stress and rest. So ideally it should be 1. If it is more than 1, it is abnormal. These are showing the counts, projections in each angle. Then these are the slice images, surface image. These are the final slices.
This can be adjusted just by clicking on. This is showing blank pages.
This one.
Yeah.
So
Business can be shifted.
shifted, yeah, but then this is the start, no? So different patients have different size of left ventricles. So this is a little small left ventricle, that's why it's blank. But if there will be a bigger LV, then all this will be covered. Or the second way is you generate the thinner slices. Then if you generate the thinner, there will be more slices. So currently it's around 6 mm. In the customization setting, you can go and make change 4 mm. So more number of images you will get. Then click on the views. These are the 3D images of the left ventricle that you can rotate and see the perfusion abnormalities. QPS image, that is the perfusion image. Then QGS, that is the quantitative data. This one is the phase analysis. So these options are there in the AC toolbox also, but the only thing is the graphics and the color and the way it is projected is slightly different.
Any extra information we get it from here or same as PCTV?
Information is same. Um, yeah, exactly same.
They work on clicking with those arrows. Zoom and frame and
This one, yeah. So if you want to magnify or minify, you can do that. Yeah, right. तो pause करो इसको. So these are the different options: right ventricle, end diastole, end systole. Then magnification options. These are the 3D images. You can see the perfusion defects in the stress data, and some areas are reversible that you can see in the stress studies. And then if you want to see the raw data projection images and lung to heart ratio, that and TID ratio is calculated. And this is the quality of the scan. You can check the sinogram, linogram, and the counts in each projection. Next is the slices. Then you can view the surface view. You can see the wall motion, contraction and relaxation. Then is the splash view where you can see the stress AC images and the rest AC images. Then these are the different 3D images of the left ventricle for the stress and rest. Then these are the perfusion images in the form of polar map where you can see the rest percentage and reversibility percentage, and this is the ratio image. You can locate the area. Then QGS, that is the gated data, where you can see the different quantitative data and diastolic volume, systolic volume, ejection fraction, and the thickening and left ventricular volume. Then these are the diastolic left ventricle parameters: peak filling rate, peak emptying rate, peak filling rate, peak filling rate 2, peak filling rate 2 divided by 3, and time to peak filling rate. So all these are calculated. Now all these parameters are available with the SC toolbox also. Then last one is the phase analysis, where you can see the stress uh, phase polar map, rest polar phase polar map. So you can see that different regions have different are in different phases. These are the graphical phase and amplitude presentation, where you can see the apical area, bandwidth, mean, standard deviation, and the entropy percentage. This is the lateral view. You can see it is displayed in the red, so that corresponds to this area, and these are the blue that corresponds to this area. Okay, so these are the different QGS data. Now, if you want to see the myometrics slices, you can directly go from this tab and you can see the systolic phase slices, and these are the these are the diastolic phase slices, and these are the systolic phase slices. So all the three views like filter back projection, uh, iterative recon, attenuation correction, and IR and C. So if you have a CT data, you can get the attenuation corrected data, and you can do the scatter correction also if you have done the acquisition with scatter window also. So if there is no scatter window, you cannot do that the scatter correction. These are the NM correction reconstruction parameters, and if you want to change any parameter and do a different set of reconstructions and see the different image quality, you can do that on this. Any change in the parameter here will impact the image quality.
How do you shift the images to this monitor?
This one you just need to click here.
So if you shift to
If you come back here, it will come there. So if you click here, it will again come. So these are the different options here. You can change the different layouts and display the images in different formats. So if you click AC and NC perfusion, you will see the slices and the polar maps. So top one is the IRAC and this is the rest IRAC, and these two are the NC images. So always doctor want to see AC and NC simultaneously so that they can detect any attenuation related perfusion or real perfusion defects. They can compare and see the give the correct reportings. Like if you see this inferior area here, because of the inferior wall attenuation, you can see a reduced perfusion, but here you can see it's more uptake in this area. So this difference is because of the attenuation. And this is the printing option provided. You have to just select the Windows printer and screen header, and then click print. So these are the printer properties. You have to go to the printer property and select the landscape, not the portrait, because monitor is horizontal, no? So every print will be in landscape. No print will be in portrait. All prints in landscape format.
So the Windows printer needs to be selected or the color one should be from this pattern
We have to select the windows in this here. Destination.
The hard copy.
To print the hard copy, yes.
To save one copy of this, we need to save it as a
If you want to save in the database, in the computer itself, then select this color one, database study 1024 color, and select this as a normal, and here you can select the screen header and then click print, and you can rename it if you want, and then click save. So this screen will be saved as a screen capture, and when you are exiting,
numerical values will which screen we need to print.
The quantitative data, yeah. So quantitative data, you have to go to the function, and if you want to stop the movement, you just click the stop, and this ROI, if you want to remove, just click here, it will be removed, and then you can print it on the using the printer. Yes, right. If you want to go back to your that application, QGS QPS, then click here, you will be back to the QGS QPS. So this is the advantage of having third-party software. You can simultaneously process with two applications. Like you started with QGS QPS, but you are in the background, you are also using the Myometrics. So that's all. Yes. Thank you.